So 82 number question is saying कि 50-year-old female, severe eye pain, redness, 6/60 vision, circumcorneal congestion, edema, shallow anterior chamber. What is the drug of choice? First you have to understand what is the diagnosis. It is nothing but it is an acute attack of the angle closure glaucoma. Why and how? See, shallow anterior chamber indicating towards the angle closure. And acute condition because this is acute pain, very high. Okay, with the congestion and the vision is also deteriorating. So it is representing that it is something acute which is because of the pain. Because IOP is high, that means there is a very high pain, very severe pain. So this is the condition of acute attack of angle closure glaucoma. Acute attack of angle closure glaucoma. And if there is an acute attack, then what you go for? First, we give the patient tablet Dimox, acetazolamide, okay, stat to decrease the pressure. If at all the patient is not responding to the Dimox, we have to shift to the mannitol, intravenous mannitol. And what is the, since acetazolamide is not given here, so you have to mark the mannitol answer. Okay. So prophylactic treatment of the angle closure glaucoma. What do you do? What do you do in the prophylactic treatment of the angle closure glaucoma? The answer is peripheral iridotomy. Peripheral iridotomy. Phacomatous glaucoma is because of which type of cataract? Intumescent cataract. And the phacolytic glaucoma is because of which type of cataract? Anyone? Hypermature cataract. It is because of lens protein. This lens protein causes a coggling of the angles leading to the glaucoma. Which of the following is not seen in the POAG, primary open angle glaucoma? Vertical cupping, horizontal cupping, bionetic sign, dot sign. A very simple question. Everybody should know. There is always a vertical cupping, na? So the answer is horizontal cupping is answer. Usually our disc is this. Normally IS anti-rule. You know, normally IS anti-rule is followed. Except in glaucoma. Except in glaucoma. Last one to go. Last one to get affected. This temporal region. Last one to affected. Last to affected. Last one to affected. My handwriting is so bad. Temporal last to affect. It is last to affected, right? Let me show you. What is this? This is the picture of the visual field. Can you see here? The blood, there is a bearing of the blood vessels. There is a lamellar dot sign. There is a lamellar dot sign means what? Cribriform fossa can be seen. Can you see? The cup is so much increased from here to here. This is the vertical increase in the cup. The inferior and the superior and the inferior neuroretinal rim means nerve fiber is thinned out, and this is the vertical cupping which is increased. This is lamellar dot sign means cribriform fossa of the posterior to the posterior to the optic nerve can be seen. This is called lamellar dot sign. What is this? There is a turning of the blood vessels like this from the edge of this. Here this is the limitation of this. Now this is the limitation, and from here there is a bioneting sign. And this sometime what we see, this is this. See this one. This is the splinter hemorrhage. This is the hard sign of the primary open angle glaucoma. Paracentral scotoma. Paracentral scotoma. Remember, paracentral scotoma is the first one to get what you get in the visual field of the POAG. Then we have the arcuate sedal scotoma, then arcuate scotoma, then ring scotoma. Okay, and then finally central vision or tunnel vision. Only tunnel vision. nerve fiber layer. In glaucoma, which layer is affected? Nerve fiber layer is affected. Iridocorneal endothelial syndrome, that is also known as the eye syndrome or eye syndrome, where the form of the iris, there is a progressive iris atrophy, Chandelier syndrome, and endothelial dystrophy. So what is associated with deposition of the progressive iris atrophy, deposition of the collagen and basement membrane, bilateral stromal edema, deposition of the glycosaminoglycans glycans. Let me tell you, what is this eye syndrome? Is a group of disorder where the iris is nervous, which is also known as the Krukenberg syndrome. C for Chandelier syndrome, E for essential progressive atrophy. What you see in the Krukenberg syndrome, there is a, you can see silver bitten appearance like. Can you see in this silver bitten appearance? Silver bitten appearance, dot dot like this thing. This is seen in the Krukenberg. Or this is, you can see there is the iris atrophy, progressive iris atrophy. This is the eccentric pupil. This is the, you can see also the polychoria, number of pupils are there. So this is the example, and also the ectropion uvea you can see here. Okay, this is the eye syndrome. So the answer for this question is obviously progressive atrophy. Question number 85 is saying the laser procedure used for treating the rubeasis iridis. Rubeasis iridis means neovascularization of the iris. Laser trabeculoplasty, laser iridotomy, pan-retinal photocoagulation, and gonophotocoagulation. See one thing, where is the stimulus for the neovascularization? Let me tell you the answer. The answer is not this, not this, not this, but this. Now you will be amazed. Since the neovascularization is in iris, then why we are treating the retina? This is the good question, right? We are treating the retina. Suppose you have to treat the reason, not the disease, not the symptoms or the signs. The reason, the stimulus, that is VESF, vascular endothelial growth factor, is from where? It is from the retinal tissues. It is from the retinal disease mainly. Okay, so you have to treat that stimulus. That's why pan-retinal photocoagulation. Nothing more to discuss. Can you see this? 100-day glaucoma. Anyone answer, please? CRVO, central retinal venous occlusion. It takes almost 3 months to have neovascularization of the iris. This is the neovascularization of iris. See the vessels here, and also the angle. Angle में जाएगा तो photocoagulation कर सकते हैं, gonophotocoagulation. Critical angle of gonioscopy, I have already told you, it is 46 degree, right? How much? 46 degree. Krukenberg spindle, it is a very important question. Chalcesian retinitis pigmentosa, sympathetic ophthalmitis, pigmentary glaucoma. The answer is pigmentary glaucoma. इसमें मिलता है Krukenberg spindle. Retinitis pigmentosa, तो I have already told you, pale waxy disc, arterial attenuation and bony spicules. इसमें मिलता है आपका sympathetic ophthalmitis. Is very important to understand. Okay. Now this is what? This is Krukenberg spindle. This is Krukenberg spindle. This is nothing but this is Krukenberg spindle, right? Which of the following topical drugs is causing the heterochromia? Iridis, latanoprost, olopatadine, prednisolone, prednisolone, or timolol? Answer. It's a prostaglandin which causes the heterochromia of iris along with the increase in the length of the eyelashes. Okay, so the answer for this question, very famous, latanoprost. Can you see this? Increase in the eyelashes because of the prostaglandin. Can you see here? What is this condition? This is the blepharoconjunctivitis. Blepharoconjunctivitis. This is because of Bremoni. It is nothing but it is blepharo. This is blepharoconjunctivitis. Now one more thing you need to remember: beta blocker can cause the bronchospasm, so cardiovascular mortality is high, and you have to avoid it in the cardiovascular diseases. Brimonidine is also a neuroprotective disease, and that's why in the Alzheimer's disease or Parkinson disease, this is sometimes recommended. Remember, which anti-glaucoma drug can be given in the Alzheimer's disease? The answer will be the brimonidine. Or Parkinson disease, brimonidine. Can, because it's a neuroprotective, right? Glaucoma drainage device. There is a drainage device because we are doing the trabeculectomy, right? It is not, the treatment of choice is the trabeculectomy. The surgery of the choice is trabeculectomy in the glaucoma, right? But there's a big but. If you are at all not able to get the proper IOP control by this trabeculectomy, you may need this glaucoma drainage device. And what are those glaucoma drainage device? You have to understand. First, let me tell you, the glaucoma drainage device drain aqueous humor to the posterior segment. Absolutely absurd option. आगे से पीछे लेकर जाना कोई मतलब नहीं है. You have to give a proper channel, and that is what the function of glaucoma drainage device. Open up the trabecular mesophyte. No. It drain the aqueous humor to the external device. Decrease the secretion of the aqueous humor. Decrease the secretion of aqueous humor. Decrease the secretion of aqueous humor. ये तो anti glaucoma का function हो गया ना. तो answer is drain the aqueous humor to an external device. So this is the answer here. What is this? Can you see? This is the stainless steel. This is fitted here like this. This is called express implant. Can be asked in the examination. I think have been asked. What is this? This is the AIIMS glaucoma valve. AIIMS glaucoma valve. So, coming to the next question, 89. The clinical photograph of the patient who has undergone a certain glaucoma procedure. This is the photo. What is this? Obviously, this is PI. This is PI. Peripheral iridotomy. Here, किससे करते हैं? NDR, double frequency NDR. This is NDR. Double frequency NDR, femtosecond organ. The answer is very simple. NDR laser. Okay. Identify the investigation modality. If you have been given this modality, then what is this for? This is for glaucoma, right? ग्लॉकोमा के लिए करते हैं RNFL, रेटिनल नर्व फाइबर लेयर के लिए करते हैं. बेसिकली RNFL, रेटिनल नर्व फाइबर लेयर के कर देते हैं. व्हाट इज दिस? पेरीमीटर. क्या पेरीमीटर है? नहीं. क्या ये ASOCT है? एंटीरियर सेगमेंट ओसिटी? नहीं. ये OCT है डिस्क का और रेटिनल नर्व फाइबर लेयर का. रेटिनल नर्व फाइबर लेयर यहां देखिए आप, ये डिस्क का है, ये डिस्क का है, और ये सारी चीजें हैं रेटिनल नर्व फाइबर के थिकनेस को बचा रही है. तो राइट आंसर इज दिस वन, optical coherence tomography or OCT of optic disc and retinal nerve fiber thickness. Coming to this, what is this photo indicate? Just remember, this is called HVF, Humphrey Visual Field Analyzer. Humphrey Visual Field. And what is this? This is Goldman Visual Field, GVF, Goldman Visual Field. ये कब करते हैं? ये कब करते हैं? ये जब करते हैं when the patient vision is slightly less, around 660, and when the patient vision is good, 612 or 66 or 680, you can do this. But for this is for the low vision patient. Pupil which responds to the convergence but not to the light. Response करता है convergence को, near reflex को. Means convergence means near reflex but not light, not the light reflex. What is the answer? The answer is Hutchinson, RP, AARP, Iridi's, myotonic. What is the answer? What should be? ARP. Remember, ARP, Argin Robertson Pupil, accommodation reflex present, accommodation reflex present, accommodation reflex present. और अब इसका उल्टा कर दो, इधर pupil reflex absent, accommodation reflex present means near reflex present means convergence में light respond करता है, and pupil reflex as absent means pupil not to the light. ठीक है. Now there are the different types of pupil you need to know. What is this? There is a no light, right? इसको समझो अकेले अकेले जरा सा. What is this? The diameter of the pupil is normal in both eye, no anisocoria. Normal response. When the light is emitted here, this is constricted, this is also constricted. But when the light is put here, this is not constricted and this is also not constricted. Means what? There is a lesion where in the optic nerve. And what is this reason? What is this type of pupil called? This type of pupil called Marcus gun. Marcus gun. So they can give you this photo and ask you the type of pupil. Similarly, Iridocornecendothelial pupil. Pupil do not react to the light. When the light is flashed, no reaction. When the patient is asked to see this finger near his eye, there is a accommodation and obviously meiosis is there. So this is the Iridocornecendothelial pupil. Where is the lesion? Pretectal nerve में lesion होता है. When the patient is asked to see, when the patient is normally, can you see here? This is anisocoria. यहाँ पे आपको anisocoria मिल रहा है, anisocoria because this pupil dilated is normally. Now, when the light is marked here, light जब दिया गया, because this is the sign of the light, then there is no any reaction. This is always dilated. This is not dilated. But when there is a near convergence, also there is a problem. Also it is remain dilated. It is dilated with the light also, with the near also dilated. अगर ये नियर से कंस्ट्रेंट कर जाता तो ये ARP होता और यहाँ पे ये ऐसा नहीं होना चाहिए था. बट अभी ये डायलेटेड है. दिस वन इज आल्सो डायलेटेड, दिस वन इज आल्सो डायलेटेड. मींस ऑन लाइट आल्सो डायलेटेड, ऑन नियर वर्क आल्सो डायलेटेड. मींस ये क्या है? टोनिक प्यूपिल, एडिस टोनिक प्यूपिल. दिस इज नथिंग बट एडिस टोनिक प्यूपिल. और ये किससे कॉन्स्ट्रिक्ट करता है? कॉन्स्ट्रिक्ट बाय 0.125% पाइलोकार्प. So ये किससे कंस्ट्रिक्ट? इट इज एडिड टोनिक पिपल एंड इट इज कंस्ट्रिक्टेड बाय 0.125%, means low dose of pilocarpine. This can be an exam, can be asked in examination. And why it is this for? It is this for because of denervation, hypersensitivity. Because of denervation, hypersensitivity, right? And where is the lesion? The lesion is at the post-ganglionic supply to the sphincter pupillae and the ciliary muscles. You have to remember this. Now, there is a fourth type of pupil is Wernicke's pupil, where the lesion is at the optic tract. That's it. Coming to the 92 number of the question, identify the most likely diagnosis of the patient from the perimetry picture. Optic neuritis, pituitary adenoma, occipital infarct, posterior fossa tumor. Where is the lesion? Can you see this? This is nothing but it is the temporal half. It is the temporal half. So it is a bitemporal hemianopia. So the lesion is at the optic chiasma. So the lesion is at the कहाँ पे? Optic chiasma. Okay. So which condition will causes the compression or something like that at the optic chiasma? Optic neuritis, pituitary adenoma, occipital infarct, posterior fossa tumor. The answer is quite clear, pituitary adenoma. That's it. Now remember this. Suppose what is this? This is optic nerve. This is optic nerve. So if there is a problem of the left side optic nerve, whole of the eye will go. This is optic chiasma. This is called bitemporal hemianopia, because temporal side of this gone, and this is nothing but optic chiasma. When there is a problem of this part, so suppose beyond this, इसके नीचे there is always contralateral homonymous hemianopia. Remember this is fact. इसके नीचे जो भी होगा, चाहे ऑप्टिक ट्रैक्ट में हो या ऑप्टिक रेडिएशंस में हो या एलजीबी में हो, there is always a homonymous hemianopia and it is contralateral. Means suppose यहाँ लीजन हो गया, तो there is homonymous hemianopia and it is on the contralateral side. See, ये left side है, this is left side, so there will be the right sided contralateral homonymous hemianopia. Now what is this? Pi in floor, this is pi in sky. Contralateral homonymous hemianopia. This is pi in floor. Pi in floor किस में होता है? Lesion कहाँ है? Floor. You have to, the patient cannot see the नीचे वाला, means the lesion in the upper lobe, that is parietal, or this is called pi in sky. This is called pi in sky. So the lesion is in the temporal lobe, or also we can say Mayer's lobe. Now this one is very important. What we call it? We call it macular sparing. Macular sparing. This, see here, the macula is spared. Macular sparing homonymous hemianopia. ये लीजन होता है occipital. The lesion is in the occipital lobe. This is occipital lobe. The macular sparing homonymous hemianopia in lesion is the occipital lobe. And one important thing, suppose this is the region and only this half, ये only macula is involved, only macula. Handwriting भी अच्छा नहीं है. Only macula is involved. Then what will be the answer? Where is the lesion? Lesion is at the middle cerebral artery, MCA, middle cerebral artery, or we can say the posterior most part of occipital lobe. If only occipital lobe is given, then the answer will be this. If only occipital lobe is given, then the answer will be macula sparing homonymous hemianopia. If only macula is involved, then the answer will be the posterior most part of the occipital lobe or the middle cerebral artery. That's it. This is all about the visual field that you need to know. Very important. Coming to the 93 number picture, the 3 number picture represents which of the following? Can you see this? Normally the patient has the bilateral, means sida, primitive, straight gaze. But when the patient is trying to see the right side, the abduction is very normal, and when the patient is trying to see towards the left side, then there is a nystagmus along with that adduction deficiency. यहाँ adduction problem है and there is a nystagmus. So what is the answer? You have to understand. Let me tell you. The answer is this one. Internuclear ophthalmoplegia. कैसे जानेंगे? इसका short form क्या है? INO. Let me write INO. I will tell you very important. INO. INO means, if you say this one, just IN. Ipsilateral nasal means ipsilateral adduction, nasal लिखो, nasal or adduction deficiency. So there is a adduction deficiency, and just keep this, just take this, nystagmus on opposite side, nystagmus on opposite side. So nystagmus on opposite side. So you can see the nystagmus on the opposite side and ipsilateral adduction deficiency. So there is a problem of the right-sided INO. This is internuclear ophthalmology. It's a right internuclear ophthalmology, more we can say. And what is the thing that is involved here? It is the medial longitudinal fasciculus. The lesion will be in the MLF, ipsilateral MLF, medial longitudinal fasciculus. Coming to this point, this is the horizontal gaze palsy का ये सारा चीज दिया हुआ है. This is PPRF. This PPRF is nothing but it is the horizontal gaze center. This pontine this is follicle pontine. So parapontine reticular formation is the horizontal gaze center. If this is involved, then we have INO, that is internuclear ophthalmoplegia. Now when we have the supranuclear gaze palsy, means up gaze palsy, then what is the answer? It is Perinod syndrome. What is the vertical gaze center? It is rostral interstitial nucleus of Casal, RINAMLF, rostral internucleus of Casal. You have to, the keyword will be Casal, CAJL. And writing is bit Kajal, CAJAL. This is very important name. Horizontal gaze center is PPRF, parapontine reticular formation. 1.5 syndrome कब होगा? When ipsilateral PPRF plus MLF lesion होगा. When the lesion in the ipsilateral PPRF plus 1 MLF होगा. And when 8.5 syndrome कब होगा? When the seventh cranial nerve palsy plus 1.5. When the 7th cranial nerve palsy and 1.5 syndrome is involved, this is called 8.5 syndrome. And one important thing, this one is the up gaze palsy. Down gaze palsy में क्या होगा? Down gaze palsy, it is in the PSP form, मतलब progressive supranuclear palsy, or we can say it is still Richardson syndrome. This is all about the neuro-ophthalmology that you will need to know. Now the important thing is that what is the diagnosis of the clinical photograph given here? This is the clinical photograph. Can you see this clinical photograph? Patient on the normal vision. This is 1. This is 2, 3, 4, 2, 3, 4, 5. On 1 there is the ptosis, complete ptosis, severe ptosis, right? When the patient is trying to see, or we have to see, there is this one, and whenever the patient is trying to see down, there no movement is seen in this condition, means patient cannot see the downward, right? Whenever the patient is asked to see here this way, there is abduction, but when the patient is asked to see here in this direction, what is happening? There is no adduction. Adduction deficiency, ptosis, adduction deficiency, and if you see that clearly, there is a dilated pupil here. You can appreciate. You can appreciate not the dilated, but you can see the. So you can see, if you can see here, that there is a dilated, mid-dilated pupil also can be seen. Best appreciated in this case, this is pupil dilated. So obviously, adduction deficiency, adduction is by the medial rectus nerve, and third nerve is supplying that one. Second is that the levator pulpis superior LPS, levator pulpis superior, is responsible for the retraction of the lid, that is also problematic. So it is the left pupil involving third nerve palsy, the answer. Now coming to this medial wall of the orbit is formed by all except medial wall of the orbit. This one कौन सी चीज से नहीं बना होता है? You have to answer this question. Sphenoid, ethmoidal, frontal and lacrimal. Let me give you an example. Here you can have the lacrimal bone. Just see this. Remember that the frontal bone has no contribution, because you can see these are lacrimal tissues. Here is the lacrimal tissues, nasolacrimal duct. Obviously, lacrimal bone will be there. Ethmoidal bone, yes, there is a ethmoidal bone in there. Sphenoid bone, body of the sphenoid bone basically is responsible for the body, medial wall. So we ruled out this frontal bone. You have to remember this. See, this is the frontal bone making the only the roof and the greater wing and the greater wing of the lesser wing of the sphenoid. It is not represented here, but they can sometimes give you this photo and ask you which is the lacrimal bone. This is the lacrimal bone, this is ethmoidal bone forming the medial wall. This is the greater wing of the sphenoid, zygomatic bone का part कुछ होता है, that is also forming the lateral wall. And in the below you have to remember this one. I am giving you an example like floor. To remember this floor, you have to remember on the floor there is a pajama. You wear the pajama below. So P for palatine bone, ZY for zygomatic bone, M for maxillary, right? You understand? Now remember, greater wing, lesser wing, body, greater wing, lesser wing, body, greater wing, lesser wing, body. लेटरल वॉल में ग्रेटर विंग होगा, ऊपर में फ्रंटल में लेसर विंग होगा, एंड इधर मीडियल वॉल में बॉडी होगा. दिस इज इंपॉर्टेंट. Now we have to understand the two important thing. Here there is a zygomatic bone and there is a frontal bone. That's it. This is how you remember this. Just remember this. And important point, this one, a pyramidal space. Orbit is a pyramidal space. Base, apex and the four wall. Now coming to this, most common cause of the bilateral proptosis in children is retinoblastoma, rhabdomyosarcoma, lymphoma, neuroblastoma. The answer is neuroblastoma. Okay. Now you have to understand what is the retinoblastoma. It is the most common intraocular tumor in child. Most common intraocular tumor in child. What is this rhabdomyosarcoma? Most common orbital tumor of child. It is intraocular, it is orbital. Remember this fact. A 20-year-old girl, see the age, previous history of the repeated pain over the medial canthus. यहाँ पे उसको पेन हो रहा है. Chronic use of nasal decongestant with abrupt onset of fever and chills and rigors. Diplopia on lateral gaze. Lateral gaze में diplopia हो रहा है, means there is a problem in the lateral rectus something muscles. Moderate proptosis, chemosis, and on examination optic disc is congested. Most likely diagnosis. अब ये बात करते हैं, कुछ भी diagnosis हो सकता है. How to rule out this condition? Basically, if there is orbital cellulitis, तो fever तो हो सकता है, chills भी हो सकता है, but optic disc में optic disc is also can be edematous. Pain भी हो सकता है, ठीक है, chemosis भी हो सकता है. So this can also occur in all these things, but chronic use of nasal decongestants or lateral gaze में diplopia is going against this orbital cellulitis. दूसरा optic disc का उतना congestion नहीं मिलता है orbital cellulitis में. Acute ethmoidal sinusitis can be a feature of, but lateral gaze में diplopia is more unlikely. Orbital apex syndrome अगर होता है तो there is a problem in all gauges, ठीक है, और chills and rigor का features उतना अच्छा से नहीं मिल पाता है. So it is most likely going with the cavernous sinus thrombosis जहाँ पे lateral rectus affect हुआ है, lateral rectus is affected and so there is a lateral gaze problem and that's why there is a diplopia. So the answer will be the B, most likely. A patient present with a unilateral proptosis. Remember, what is the most common cause of unilateral proptosis in adult? Thyroid ophthalmopathy. What is the most common cause of bilateral proptosis in adult? thyroid ophthalmopathy, and there are different signs of thyroid ophthalmopathy. One, Dalrymple sign, डर नहीं, डर से lid retract हो जाता है, means Dalrymple, retraction of eyelid, ठीक है. von Graf sign, there is Inroth sign, edematous, E for edema, E for periorbital edema. So these are the some of the signs you have to remember. Just go and remember all this. This is also important, but I have not covered it. No thrill in the patient present unilateral proptosis, which is compressible. It's compressible lesion. Increase on bending forward means there is something which is filled, which is filling on downward movement, on below or bending. Brute, there is some brute, means some pulsation is also there. MRI with the retroballoon is the enhancement, the proper diagnosis. आपको क्या लगता है एवी मालफॉर्मेशन में न्यूरोफाइब्रोमैटोसिस में ये होता है? No thrill or brute, obviously. So no thrill or brute AV malformation को rule out करता है. Neurofibromatosis does not increase on bending. Encephalocele or vital varices. This is varices. So these two are the important one. But in the encephalocele, retrobulbar mass with enhancement is not there. So the answer for this question, remember, orbital varices. Most common cause of fracture of the roof of the orbit. Usually most common valve, orbital valve fracture is floor. Most common by the punch, floor होता है. बट यहाँ क्वेश्चन पूछा है रूफ का क्या होता है. Blow on the upper jaw, blow on the forehead, blow on the parietal bone, blow on the back of the head. The answer is very simple. ऊपर तोड़ोगे, ऊपर मारोगे तभी तो ऊपर होगा. That is blow on the forehead. Now what is this? This is the fracture orbit of the CT scan है. Fracture of this, and this is nothing but oil droplet sign on CT scan. Fracture of the bone, and there can be the entrapment of the inferior rectus, और जिसके कारण से there is a problem in the difficulty in seeing down. Last question of the day, but don't go. There is some miscellaneous topic also discussed in just 2 to 3 minutes. A 60-year-old man presents with watering from his right eye since 1 year. Syringing revealed patent tetanus system. Rest of the ocular examination was normal. Provisional diagnosis lacrimal pump failure. Confirmation the diagnosis is done by lacrimal pump failure is there. आप प्रेशर सिरिंजिंग करने का कोई मतलब नहीं है, because there is no blockage, because there is a lacrimal pump failure. Dacryocystography यानी कि आप इसको पता करोगे what is the exact problem is there. So what you are going to do is, the answer is C. Dacryocystorhinoscintigraphy, exact location of the problem. What is this? This is DCG. This is DCG, dacryocystography. And what is this? This is nuclear dacryoscintigraphy. What is this? ये 2 महीने 20 आफ्टर ओनली 24 months के बाद ही ट्राई करते हैं. दिस इज प्रोबिंग. व्हाट इज दिस? ये दिस इज यूज्ड इन द जोन्स ट्यूब है. दिस इज जोन ट्यूब यूज इन द canalicular formation. What is this? This instrument, Hertel's exophthalmometer, to measure the intercanthal distance. This one. Hertel's exophthalmometer. ठीक है. Last slide of the series. A patient of having this type of swelling or white mass protruding on the lateral side. CT scan is showing the diffuse enhancement or diffuse homogeneous mass extending to the orbit. It is suppose this is a patient of 6-year or 7-year old. Then what should be the answer? Rhabdomyosarcoma. इसमें याद रखना है कि मायो D1 पॉजिटिव होता है, डेस्मिन पॉजिटिव होता है. व्हाट इज दिस? This is nothing but duochrome test. In the duochrome test, based on chromatic aberration, based on the chromatic aberration for slight spherical refinement. What is this? This is Maddox rod and this is wing. This is wing, this is rod. And what is this phenomena is called? The patient normally have a ptosis here, but on opening the mouth there is a retraction. Patient normal ptosis in the left eye, but on opening the mouth there is a retraction. What is this phenomena called? This phenomena is called Marcus gun jaw winking phenomena. What you do in this tarsal frontalis sling operation? Surgery is frontalis sling surgery. Frontalis sling surgery. What is this? This is an unfortunate condition of cryptophthalmos because of problem at in lead fusion state. लीड फ्यूजन के स्टेट में प्रॉब्लम के कारण that is around 7 weeks there is a problem. Okay, at 7 weeks. So this is a no formation. This is all about the series of the rapid revision. I hope you have revised it well, and I pray that the questions, most of the questions should come from this. You will get benefit from this. Just have faith in what you have read. Remember what you have learned. Do your best. Thank you and all the best.